Well, thank you so much for the time today. And I'm just going to go ahead and get started. It sounds like you all are going to be very busy this afternoon. So let's just go ahead and start with our metrics. As of yesterday, we have confirmed 29,011 total cases of COVID-19 in our community. And we have experienced now 431 COVID-related deaths. It's a very sobering number. Rightly so, because it's just not a number. It's each one of those is a person in our community, someone who was loved by others and cherished by them. So I just wanted to take a moment to recognize that. Unfortunately, our current metrics have not improved since the last time I saw you. In fact, our case rate has increased from 113 to 121 per 100,000 in the last week. And overall, as you'll see on the next slide, we are experiencing a very high level plateauing of our cases. That's not exactly the place that we want to be as we enter the major holiday season. And the CDC still considers Buncombe County an area of high transmission. Our current percent positivity has increased since last week as well, from 4.4 to 4.7 this week. While this is still below the desired 5%, an increase is definitely not what I wanted to see as we are a week away from Thanksgiving. It's encouraging, however, that our death rate did decrease again this week, bringing our death rate to 0.8, so about 2 deaths in the last week per 100,000, down from 1.5 the week before. Our hospitalization rates remain encouraging. They are low and stable and have been for a few weeks now. So in the end, the message today is that we've plateaued at a really high level of cases. I am hopeful that the increase that we saw from last week to this week does not continue into the next week. But much of that depends on us. And when I say that, I know that folks are tired. I know they're really fatigued by COVID. I hear almost every day the frustrations from folks that COVID has stretched us. It has most certainly exhausted us. And I think, not that I like to humanize a virus, but that's what, COVID-19 is hoping that we'll give up. And it's hoping that we'll be quitters. And I'm asking everyone listening not to give up, that we have a lot of things going well for us. I'm going to be talking about those in a little bit as I talk about our vaccine efforts. But with the holidays approaching, please help us minimize the impact of COVID-19 this holiday season. Please begin planning your events with safety and health in mind. We'll talk more at the end about how you might plan for the upcoming holidays for yourself and for your family and friends. For now, remember that we do have a face covering requirement for indoor public spaces in our county, a necessary tool right now as we continue to land in this area of high transmission per the CDC. And when added to our other efforts like vaccine uptake and quick identification of cases, we have the potential to stave off large peaks in cases through the holidays and enter the new year in a place of great hope in controlling and managing COVID-19. Before I talk about the case distribution that we usually go over, I wanted to point out that leveling off or that plateauing I mentioned before, the very far right of that curve. You can see that stepwise sort of pattern that I mentioned last time, and now we're seeing just a leveling off of that. The levels that we're seeing now aren't too different than those of the summer 2020 surge and the later stages of the winter 2020-21 surges. And again, that's with the holidays yet to come. But not much has changed in the distribution of cases. The greatest proportion remains in our 25 to 49-year-olds, which has been consistent. Our 0 to 17-year-olds actually remain stable in the proportion of cases. They've been around 21% for the last few weeks, after seeing much higher levels previously. While case rates have worried me, most certainly this week with their slow change, It's been the vaccination arm of our response that I gain hope. That's where I gain hope right now. That you can see here, I want to draw some attention to the red line that you see at the bottom that creeps up toward the end there. That's not a line that you've seen before because that represents our 5 to 11-year-olds. And I just want to say they've been eligible for less than 2 weeks. And already we're seeing that 15% of our 5 to 11-year-olds in Buncombe County have received their first dose. I just want to commend our vaccine providers in our community for that dedicated effort, but also commend those families and those kids for coming out. That's almost 2,800 kiddos that have become superheroes for their communities, protecting themselves and helping to build a stronger shield around our community. I actually got to meet some of these superheroes at our 40 Cox location. I got to learn about dinosaurs, and I got to learn about their favorite foods, watch them color and be creative, and also got to talk to some parents and caregivers who expressed their gratitude to the community. We also saw many parents and caregivers getting whatever dose they needed as well at all of our sites, most often a second dose or a booster. So it definitely was a family affair. Many thanks to those families who have joined us so far, and we welcome others to join us at upcoming events. I'll talk more about those events in just a second. Overall, about 65% of our total population has received at least one dose, and approximately 74% of the eligible population has received at least one dose at this time. So let's move on and talk a little bit about vaccine operations and our current efforts. The last few meetings, we spent a lot of time covering all of our past events and the planning for 5 to 11-year-olds, so I'm not going to go through all of that again. I'm really going to focus today on our current efforts for 5 to 11-year-olds. And as of last week, Buncombe County HHS has administered 104,928 total doses of COVID-19 vaccine. And we continue to have our fixed site, which is at 40 Cox, and we continue to do community outreach events. So just a reminder that our fixed site is now Tuesday through Friday, 9 to 4, located at the health department at 40 Cox. In that very first week, we administered 320 pediatric doses through the 40 Cox location. We have several community outreaches scheduled. I call these the Saturdays at school. They are also 9 to 4. We just completed our first one, which was November 13th at Asheville Middle. Very well attended. We reached 393 people, with almost 250 of those being pediatric doses, and 147 of those being folks who were 12 and older. Up next, we'll have North Buncombe High School on November 20th. Again, Saturday, 9 to 4. And then a break for the holiday for folks, well-deserved, and then come back on December 4th at Irwin High. And also, because of the FEMA resource out here in Western North Carolina got extended until December 14th, they have also added high schools to their schedule. So we'll have December 4th at Irwin, where Buncombe County HHS will be giving vaccine. But also at the same time and same day, we'll have Robertson High, where MAHEC and FEMA will be giving out vaccine. And then on December 11th, the Buncombe County HHS will be at Owen High, and our partners at MAHEC and FEMA will be at Reynolds High. And then there are also other vaccine opportunities in our community, including the Eddington Center in Asheville through the state vendor partner StarMed. We also have many major pharmacies like Walgreens, CVS, Ingalls, who are also providing pediatric doses and all other doses. And there are also some medical providers who are providing that. So most of the sites that I mentioned today are offering all vaccine types, which is making it a great opportunity for grown-ups to get whatever dose they need that they may be missing, while their 5 to 11-year-old gets their first dose. So again, I just want to say kudos to our team for making this outreach event, all of our outreach events, welcoming for 5 to 11-year-olds. truly a celebration, as there were balloons and videos and other activities to really make it a pleasant experience for those in the 5 to 11 range. And as a reminder, you can always check Find My Spot locator to find a vaccine provider near you if one of those spots that I mentioned does not work for you. So we've talked a lot about vaccine, but particularly as we enter holidays and may be interacting with more folks, and folks might, who might be having symptoms, may need a reminder that if you are having symptoms, any of the symptoms listed on this slide, please get tested. There are several testing options in our area, and you can find one using the Find My Testings location website. You can visit Harrah's Convention Center, where, again, the state vendor partner StarMed is also providing testing opportunities. Also, while vaccination is our best tool to prevent illness, if you do contract COVID-19, treatment is available, and including the monoclonal antibody treatment, it is available to those who have had symptoms of COVID-19 for 10 days or less. And if taken early, can reduce the risk of severe illness, hospitalization, and death. So you can check out the covid19.ncdhhs.gov/find treatment website to find a provider near you. So as we head into the holidays, particularly as this is the last time before Thanksgiving that I'll be speaking at a briefing, that I wanted to provide folks with some holiday tips and recommendations as you think about your Thanksgiving holiday. And as you ready yourself and your family for Thanksgiving, please think about a few tips and recommendations, including protect those not yet eligible for vaccination by getting vaccinated, plan events outdoors if possible, and avoid crowded indoor spaces. In communities with substantial or high transmission, should you be traveling, in communities with substantial or high transmission, all individuals should wear a mask in public indoor spaces. We already have that as a face covering requirement here, but if you travel elsewhere and they do not have a face covering requirement, please remember that recommendation. If you are sick or have symptoms, please do not host or attend a gathering. I think that's one of the most important ones, because this is a special time for families. And it's really hard sometimes to say, hey, I can't come, but this might be the very best decision you make. If you have symptoms, please do not attend, and please do not host a gathering. Instead, please go get yourself tested. Please don't assume that it's a cold. Right now, as I said for the last several weeks, the predominant thing that is circulating right now is COVID. So go get yourself tested just to confirm, and please stay home. For our folks who are going to be traveling, please review the CDC recommendations for travel. Here are just a few of those, including that the CDC still recommends delaying travel until you are fully vaccinated. If you are considering traveling for a holiday or an event, visit the CDC's travel page to help you decide what is best for you and your family when you are traveling. If you are not fully vaccinated and must travel, follow the CDC's domestic travel or international travel recommendations for unvaccinated people. And everyone, even people who are fully vaccinated, are required to wear a mask on public transportation and to follow the international travel recommendations. So as I close out today, like I said, this is the last time I get to talk before Thanksgiving. I did want to take a moment to wish everybody in our community a very healthy and safe Thanksgiving, and just want to express my gratitude to our public health staff, emergency management, all other county departments and community partners who have given so many hours, so many weekends, and so much of yourselves to respond to COVID-19 and still provide all the very needed services in our community. I am thankful to your families and your loved ones who have and continue to share you and your time with us as we have tested, investigated, traced, housed for isolation and quarantine, and continue our vaccination efforts for our neighbors. I can't express my heartfelt gratitude enough to everyone. So thank you, commissioners, for your time today in this presentation.
Thank you, Stacy. Commissioners, are there any questions? All right, thank you very much.
Thank you.
The next item on our